A new cancer machine can fill a room and still leave a national shortage. That sounds impossible until the machine is switched on. A patient does not walk in, press a button, and receive radiation. Each treatment depends on a protected building, a carefully written plan, a team of specialists, and enough open time on the machine to repeat the treatment safely. This is the useful idea behind Wellington's new linear accelerator. Radiation capacity is not a collection of expensive machines. It is a chain, and every link has to be ready at the same time. In July 2026, the installation of the first of 2 replacement linear accelerators was announced for Wellington Regional Hospital. It produces high-energy radiation and directs it towards a tumor while the patient lies on a treatment bed. The beam can destroy cancer cells, reduce the chance that cancer returns, or ease pain when a cure is not possible. A replacement is good news. It can make treatment more reliable and allow newer techniques. But replacing an old machine does not automatically create one extra treatment line. The older machine leaves as the newer one enters. That difference matters because New Zealand's shortage is larger than one room. Follow an imaginary patient after a specialist decides that radiation is the right treatment. The first treatment day is still some distance away. The team must learn the exact shape and position of the tumor. A planning scan creates a 3-dimensional picture. The patient may need a fitted mask or another support, so the body returns to the same position each time. A radiation oncologist decides the target and the total dose. Specialist planners and radiation therapists work out the beam angles. Medical physicists check that the planned dose reaches the tumor while protecting healthy organs as much as possible. The plan is checked again before delivery. Only then does the patient enter the treatment room. One visit may take around 15 minutes in the room, but the full course may require several visits. The number depends on the cancer, the purpose of treatment, and the method chosen. Some patients receive one session, others return on many weekdays. Every appointment uses a piece of the same daily machine schedule. If a linear accelerator needs maintenance, the lost time cannot always be moved to tomorrow. Tomorrow already has patients. Machines therefore need spare capacity as well as technical strength. The workforce is just as important. New Zealand needs radiation oncologists to make clinical decisions, radiation therapists to plan and deliver treatment, and medical physicists to test the equipment and dose. Training any one of those professions takes years. A new linear accelerator without enough people can become a very advanced waiting room. The pressure had been building for a decade before the Wellington replacement arrived. A national facilities study compared the period from 2011 to 2021. The number of radiation treatment courses grew by 29%. Full-time radiation oncology positions grew by only 9%, and doctor caseloads rose by 19%. The number of linear accelerators increased from 28 to 31. Population grew faster, so the number of machines per million people fell from 6.4 to 6.1. The study used 7 machines per million as a useful benchmark for a high-income country. It also found that about 55% of New Zealand's linear accelerators had reached or were approaching the age when replacement was recommended. That creates 2 bills at once. The country must replace aging machines simply to protect existing service. It must also add capacity to meet a larger and older population. The State of Cancer in Aotearoa New Zealand report, published in 2025, showed how this becomes a daily access problem. It counted 25 Linacs across 7 public cancer centres and another 8 in private centres. It estimated that about half of people diagnosed with cancer would benefit from radiation treatment at some point. Among patients in the faster cancer treatment pathway who received radiation, 83% began within 31 days of the decision to treat in 2024. That was down from 89.1% in 2020. The national target is 90%. A target does not make every patient medically identical. Some treatment is urgent, some plans are unusually complex, and some people need other care first. The number still gives the system a shared promise to organize around. Distance makes the promise harder. Radiation treatment has been concentrated in a small number of centers because a linear accelerator needs a specially protected room and a complete expert team. That concentration supports safety and complex care. It can also make a patient travel for hours or live away from home for several weeks. The cancer report noted that travel costs, accommodation, work, and care for dependents can affect whether a person accepts treatment. Those burdens fall especially hard on rural families and people with less money. So a new machine changes more than a waiting list. When it opens in the right region, it can return evenings, petrol money, and family support to a patient. New centres and additional linear accelerators were planned for several parts of New Zealand after 2025, including Northland, Hawke's Bay, South Auckland, Nelson Marlborough, and Canterbury. The careful word is planned. A machine must be bought. A protected room must be designed and built. Staff must be recruited and trained. The service must be tested before the first patient lies on the bed. This is why a ribbon cutting can be both a success and an incomplete answer. Wellington's replacement protects a vital part of the network. It does not erase the workforce gap, the aging equipment elsewhere, or the distance between many homes and treatment centers. The real measure comes later. Did more people begin treatment within the promised time? Could centers recover when a machine stopped? Did rural patients spend fewer nights away from home? Were specialists given enough time to plan safely instead of carrying ever larger caseloads? Those questions turn equipment spending into patient care. Follow this channel if you want more stories about the quiet systems behind everyday life in New Zealand. The machine is the visible part. The service is the people, rooms, checks, travel, and time gathered around it. Cancer care grows only when the whole chain grows together.